To turn to the last presentation for this section from Peter Ubel. While Peter's walking up, just want to emphasize we've talked about the importance of financing and economic incentives. They do have a big impact on policy, but hopefully what's also been clear is that you don't get good policy just by thinking about economics. And you've heard a number of presentations that started with the opportunities for care improvement, the opportunities for making a difference in people's lives. Don's talk, I think, was really illustrated the heart behind many of these policy initiatives too. So we're trying to put those together. But we also need to put that together with a real understanding and appreciation of how humans actually behave. And what better person to talk about that than Mr. Workstream himself back this afternoon, Peter.
Thank you. Yeah, and I'm going to just talk about a couple examples and really show how the Margolis Center is going to help another stream. It's not an official work stream, but a stream of work happen that would not happen or would not happen nearly as quickly without the center. And that's one is that I'm hoping within the next 6 or 12 months to establish a program for improving healthcare consumerism within the center, or PIC. Sorry, I'm Vicky. I knew I was the only one who would like that joke. And what I mean by consumerism and healthcare consumerism is grocery shopping. When you shop for groceries, you make choices that very strongly influence your health. When you enroll in insurance, you're making a choice that will have a big impact on the kind of healthcare or even whether you receive healthcare and when. Consumers are influenced by direct-to-consumer advertisements that face healthcare choices that they discuss with their clinicians. They increasingly have high out-of-pocket expenses that they factor into their healthcare choices. And so all of these and other things fit in with what I would call healthcare consumerism. And I think that program fits very nicely within the Margolis Center. And I'm going to tell you about two issues within it and show again how the Margolis Center will make them happen better and faster. One is just an example of how insurance choice has some strange behaviors that influence it. So under the Obamacare healthcare.gov website, people can get subsidized insurance and get, in fact, a set of plans to look at and decide which one is best for them. In an ideal circumstance, they're going to look at the cost, the monthly premium cost, and the kind of out-of-pocket expenses they're likely to incur in a year, how much risk they're willing to take for having high out-of-pocket expenses versus lower premiums, and then make a choice that fits their values. With the help of Karen Schur, who raised her hand. Karen is an MD PhD student here at Duke with a PhD in consumer behavior. And then more importantly, with the help of Annabelle Wang, and she didn't raise her hand very high there. Annabelle, who is going to be a future MD PhD student, I think, within the next year. We did a very simple study. We gave people screenshots from the Obamacare websites, and the current website, when you hone in on plans, it orders them from lowest monthly premium to highest monthly premium as you scroll down the screen. And so half the people, we gave them that version. And the other half, we just flipped the order with which they saw those plans. And so it went from highest monthly premium to lowest. And we had dramatically different choices. That shouldn't happen. That's something that needs to be fixed. And so that's the kind of research that fits under trying to improve healthcare consumerism. And I bring that example up mainly to brag about Annabelle and Karen, but also we just recruited Charlene Wong to come here to Duke next year. She is a pediatrician finishing her adolescent medicine training at CHOP, Children's Hospital of Philadelphia, and an absolute superstar researcher coming out of a Robert Wood Johnson Clinical Scholars Program there at Penn. And we got her here, well, okay, her parents live here and they offer free babysitting. But we also got her here because she heard about this, the Margolis Center, and that got her extremely excited. And more importantly, her success here is going to be much more likely because, well, she'll succeed probably wherever she goes, but she's going to succeed that much better, that much faster because she'll be situated in the center. Whereas just sitting in pediatrics, she's not going to be surrounded by a lot of health policy researchers. So it's really great she has an intellectual home to help with her research. And I mention her now because she's done a bunch of tremendous research on health insurance choice, and so she'll fit right into this line of work. The second thing I'm going to tell you about is a USDA-funded center that I now direct, the Becker Center. It's a center that looks at how to use behavioral economics to improve food choices. Terry Hartman is the assistant director of that center. It's a center that a majority of what we do is to focus on helping people in the SNAP and WIC programs, and SNAP used to be called food stamps, but help those people, help them make healthier food choices within the context of those programs. It's important to mention it first because we're not just about healthcare in the Margolis Center, we're about health. And so we're trying to impact the kind of food people eat and hopefully make them not need as much healthcare in the future. And we're about to run a series of experiments in family fare stores around the area and randomized trials of trying different things to see if we can increase the percentage of people who come out of those stores and buy healthy foods rather than the majority of what's on the shelves there. And one of the other things that's really important in these kinds of efforts, and what Margolis Center will help happen, is that we now can draw upon a pool of people working at the center that make it easier when you need a third of a research assistant for 6 months, or you need someone with conversation analysis skills like Kelly and Christine that David mentioned earlier. And many times there are people, especially when you're outside of a big place, a research shop like DCRI or Department of Medicine, it's hard to hire a half of somebody. It's really hard when you're in the parts of campus where people don't write as many grants. With the Margolis Center, we're going to make it much easier for people to have a network of people they can work with, and when they get funding, to be able to draw upon a pool of talent to get the work to happen. So, thank you very much.
Thank you.